Okay, you ready? Okay, so I did a research proposal on delirium, and specifically in acute care. So the problem is delirium identification and intervention. This proposal will be done at a small rural hospital in Southwest Indiana. And the intervention will be the delirium assessment using the confusion assessment method, which I actually printed out some just in case you guys don't know what that actually is. If you've ever worked at a bigger facility, I know a lot of times they do use this. So that's just the little scale that you go through and document on once per shift. Okay, so delirium is a cognitive impairment in the hospital setting. It causes confusion and overall altered mental status. There's a lot of different causes. It obviously increases negative patient outcomes. It's more apparent in intensive care settings, which would be beneficial bringing it here for us. Mechanically ventilated patients experience delirium at a rate of 85%. So this can have a lot of negative outcomes. It can prolong hospital stay and make it harder to extubate these patients. Okay, so I found 5 studies going over both delirium and the confusion assessment method. The first one was just to show how easy it is to use the confusion assessment method, and it's not very variable. Usually everyone finds the same findings because the scale is really easy to use. Both patients with delirium and without delirium were assessed in this study, and 33 researchers completed it, and 100% of the assessments all matched. So it's very easy to use. The second study completed was to evaluate critical care nurses' knowledge and assessment skills using the confusion assessment method. It's also called the CAM. If I say CAM, it's the same thing. A pre-test and a post-test were used to evaluate education provided to these nurses. 61 nurses participated, and the results after the post-test increased significantly. The third study was mainly done on agitated and sedated patients, so these would be probably like our 3 West and our vent patients. Once again, education and a pre-test and post-test were used. Prior to the education, 236 assessments were audited, and only 85% were actually doing the CAM once per shift. And then after education, 636 assessments were audited, and 99% of nurses actually completed it after this. So compliance overall increased 95%. And the next study was a cross-section study. I guess they revamped the CAM a little bit, so it was just comparing the new version versus the old version. 101 patients over 75 years old were assessed in this study, and the new revised method was 95%, had a 95% delirium identification rate, so it was a little better. The next study focused on intensive care nurses again. 2 nurses assessed the same patients, and 4 pairs of the nurses' assessments were similar, and 3 pairs were variable, so this institution definitely needs more education. And my PICO question, everyone loves PICO. The problem is delirium assessment intervention. The intervention, like I said, is the confusion assessment method compared to here where we don't have any delirium assessment or protocol whatsoever. And hopefully our outcome would be better assessment and identification and earlier intervention.